Great. Good morning, everyone. So my name is Josie Silverman Mendez. I am the new SafetyNet Outreach and Grant Coordinator. This is a brand new position within the Community Partner Outreach Program here at the Oregon Health Authority. And I will be presenting an overview of Oregon's SafetyNet Capacity Grant Program this morning. So the SafetyNet Capacity Grant Program was actually established in 2010. And it operated from 2010 to 2012. It went dormant for a few years, and then it was reinvigorated with $10 million in funding by the state legislature in 2015. And the intent of the program has always been the same, the goal being to connect children who do not qualify for state or federal health insurance programs, so the Oregon Health Plan here in Oregon, to primary and preventative health care services. It's important to point out that this is not a health insurance program. Oftentimes folks get confused on that point. But this is seen as an important step to cover all kids, which is a state-level advocacy effort to change Medicaid rule in Oregon to allow coverage for all children regardless of immigration status. But this is not cover all kids. I find that it's important to make that distinction. The grant funds in two areas. So we have grants available for SafetyNet clinics across the state. The clinics are providing the direct services to a full suite of primary and preventative health care services to children. And then we also have a subset of our grant funds that are going to community-based organizations, again, across the state. And those organizations are really embedded within the community. They're doing outreach and education to spread word of the program, identify children who are eligible, and then facilitate a referral to a clinic in that child's community for services. The timeline for the program, so we are eager to get this officially kicked off as soon as possible. Again, I've been in this position for about 4 weeks now, and we're hoping to have our grant contracts officially in place in December so that folks can start providing the services and connecting children to care. We had an initial round of grants that have, again, been provisionally awarded, and those organizations will be funded from the date of contract signing through next October, so October 2017. We're also in the process of identifying regions in Oregon where we did not have organizations apply for the grant the first time around, and where we need where we know rather there's need for a program such as this. So I've included those counties on the slide, knowing that we have provider entities tuning into the webinar today. If you are located in any of those counties, and if you are considered a SafetyNet clinic, so a federally qualified health center, a rural health center, a tribal health center, any sort of nonprofit health center, you would qualify to be able to apply for a grant. Again, if you are in any of those counties listed on the screen, we would love to talk to you about potentially coming on board. And for the round 2 grantees, we would be funding them from basically the date of when we're able to get their contract signed, also through next October. So who qualifies? The qualification criteria is pretty straightforward. So it's children who are under 19 years old, so up until their 19th birthday. And again, these are children who do not qualify for state or federal health insurance programs. So that includes the full Oregon Health Plan and qualified health plans through Oregon's health insurance marketplace. It's important to point out that kids can be enrolled in CALM and still access services through the SafetyNet program. And if they are not enrolled in CALM and they are eligible for CALM, we would definitely encourage them applying for CALM and getting connected. But again, they can still be on CALM and access services through the SafetyNet Capacity Grant Program. In terms of services that are provided, so all of the clinics that are funded through the grant program offer a full menu of physical health services. So things like checkups, immunizations. Additionally, depending on the clinic location, they may also offer the services that I've included on this slide. So oral health services, vision, mental health, behavioral health, in addition to some enabling services such as help with transportation, interpretation, things along those lines. In terms of cost, for children who are screened eligible for the program, there is no cost to access primary and preventative care at a grant-funded clinic site. And there's no household income limit for children, again, who screen eligible in order to access services at no cost. It's important to point out that we are working with the Oregon Primary Care Association right now to finalize some protocols specific to federally qualified health centers who are funded through this program. And the protocol is going to include steps for how they account for the services they're providing at no cost to children. So there's certain protocol in terms of how you write off those services on the clinic side, and we're working on that guidance for our federally qualified health center partners right now. How to connect to services. So we would encourage you to refer children and families to a grant-funded community-based organization. I'll go over who those organizations are in a second. The community-based organizations are able to screen for eligibility. They will provide a paper referral voucher for the child, and then they'll also help schedule the appointment at a clinic location that's most convenient for the child or the family. And additionally, they can do any sort of follow-up as needed to make sure those referrals are being met. There are regions in Oregon where we don't have community-based organizations funded for the outreach, education, and referral piece, but where we do have clinics. So if you're in a region where there is not a community-based organization funded through this grant, you could go ahead and just refer directly to the grant-funded clinic in your region. So this is the list of round one participating safety net clinics in Oregon. I'm not going to go through every single one, but again, the slides have been made available to you. We are able right now to cover 20 of Oregon's 36 counties with grants, which is great. And again, we're actively looking for new clinic partners and community-based partner organizations in regions where, again, we didn't have applicants during the first round of funding. And then this is the list of the round one community-based organizations that, again, are provisionally awarded grants for this program. So in terms of how to stay updated, you are welcome to get in touch with me directly. I've included my email and phone numbers. I will continue to make information available through the provider collaborative. In addition to the community partner application assistor collaboratives that our regional outreach coordinators facilitate across Oregon at the county level. We'll also have updates in our community partner newsletter on group site, and then we are quickly working to develop program materials, including web content and some social media content that we will be sharing across our partner organizations to get the word out. So you'll likely be hearing about this program through various fronts as we work to get that information out. So we do have time for some questions, if there's any questions from the audience. And Jennifer is going to help facilitate us looking at these. Let's see. So the first question, how do you anticipate that the failure of Measure 97 will affect renewal of grant funds for the next biennium? The answer is we don't know. So unfortunately, that's the answer to that question. We don't know. For children who are in the process of applying for the Oregon Health Plan or who are technically eligible but still unable to successfully sign up, does this program allow for them to be served? So I think this question is basically saying there's a child that is eligible for the Oregon Health Plan, but they haven't yet had their application process, so they're not enrolled in OHP. Technically speaking, yes, but we would definitely encourage connecting to OHP. That should be the goal. And then third question, Virginia Garcia was omitted on the list of outreach and eligibility partners. Deb, that is my mistake, and I will update that slide. Thank you for catching that. So Virginia Garcia happens to be one of our clinic partners that is funded for both direct service provision, and they're also engaging in outreach, education, and referral. So thanks, Deb, for catching that. Any other questions? Okay, so again, feel free to contact me directly if questions come up or you'd like additional information. Thank you very much.
All right, we're just going to take a minute and pull up the next slideshow we're going to talk about. Let me see if questions did just come in. So Josie, what is the process to finalize the accounting for costs?
So we are, I believe this is probably coming from a federally qualified health center. We are working with the Oregon Primary Care Association to develop a guidance document that will include all the steps for how you account for writing off the costs on the clinic side. So more to come on that once that document is finalized. Great question.
All right, and I'm going to go ahead and get Colette going here on the Provider Collaborative follow-up.
Hi, you guys. Welcome. I am the Provider Campaign Coordinator with OHA's Community Partner Outreach Program, and we have some other information we'd like to share with you today. We've already heard from Josie Silverman Mendez, and we will now move on to questions and answers from the Provider Assistor Summit that took place in October. And then we'll talk about upcoming events and our next Provider Collaborative webinar opportunity. So from the Provider Assistor Summit in October, we heard a number of questions, and I wanted to make sure that we were able to not only share with you those questions, but also share the answers with everyone, even those who couldn't attend, which is why we are going over these in the Provider Collaborative webinar. So one of those questions that came up, what should we, community partners, do about member term dates that do not show a specific date? Currently, we have to call or email OHP Outreach to get end dates. It would be nice to eventually have a place for providers to see a forecasted end date in MMIS. So end date also referred to as the renewal date. Right now, there is not that information visible to provider partners in the provider web portal, and it is definitely something we've talked about internally, but it is not possible at this time to change MMIS to reflect renewal dates in the provider web portal. So that is something we want everyone to be aware of. We have made the request and are working on getting more information about what it would look like in the future to make changes to what is visible in the provider web portal and what information is stored in MMIS, but at this time it's not a possibility. Though we will continue having that conversation. Any progress that is made or if any new information becomes available, we'll definitely share with our partners. On the right side, we have in the applicant portal, community partners who are able to, who are using the applicant portal, and we want to encourage all of our current community partners to use the applicant portal when possible. These folks will have better information around renewal dates for those members that they've assisted. So we definitely encourage our community partners, and you guys on the phone would be primarily our provider assisters, to use one as much as possible, and when your staff is providing application assistance, get that consent form completed and submitted to OHA so that on the back end we can link those members to your organization's assisters in one so that they can view that renewal information moving forward. As we move into 2017, more and more members, when they become, when it becomes time for them to renew, will be able to do so through the one applicant portal, which will make it easier for community partners to plan for the renewal dates of their members. And if you want more information about who is currently eligible to renew in one and who still needs to complete the manual renewal process, I would encourage you to reach out to your regional outreach coordinator. And if you don't know who that person is, I would reach out to me, and I can help you connect with that person. Another question that came up at the Provider Assistor Summit: why is it taking a long time for TPL, also called third-party liability or other health coverage, to get removed from a member's case in the provider web portal when TPL has been entered into the reporttpl.org? So currently Health Insurance Group, who manages that online web form, is about a week out in processing. So if it has taken more than 2 weeks to reflect in the provider web portal for that TPL change, whether that's an addition, a change, or a removal request to show in the provider web portal, they are suggesting that the change be resubmitted, or the community partner or provider, not client, can contact the the email up on the screen there that goes to the Health Insurance Group to have it looked at. So again, wait the 2 weeks, allow for 2 weeks for that change to get updated in the provider web portal. And another tip that they provided was when those requests or those changes are being submitted through reporttpl.org, make sure that you are seeing a confirmation number at the end. If there is not a confirmation number after that form has been submitted, then that may mean that the form did not get submitted and did not pass through over to HIG. So you want to make sure that that confirmation number is visible, and I would hang on to that if you're assisting members with that form. Another question, can you provide more information about the Aging and People with Disabilities medical program? So those programs do fall under APD, which is within Department of Human Services, DHS, and not OHA. So those are not technically our programs, but I have provided some handouts on the 2 kind of categories of medical programs available through APD. And so that is the OSIP-M and the Medicare Savings Program handouts that you should have in your webinar, your GoToMeeting dashboard there. So you can just drag those to your desktop and view those. And certainly let me know if you have questions. So again, these are DHS APD medical programs, so they would be the best, your local branch office would be the best resource for information.
So Paulette, do you know if those handouts are available online for people who are watching the video and are not attending?
Yeah, so we, you can actually, most of the attendees who are on today should have access to the form server in BIP, so they can search using those form numbers up on the screen there. You can also, you could also reach out to me if you had any trouble finding those.
Okay. Very good, thank you.
Another question that came up, where do we find the OHT diagnostic code list? So we provided a link up on the screen to locate those lists. The code groups are about halfway down on the right side of that page under code groups for claim processing. There is also a training handout from a past provider collaborative webinar where this topic was discussed. And if there are additional questions, as Jennifer mentioned, we can track those and follow up with you guys who pose those questions. Another question came up, which is, one, organ eligibility has different race ethnicity options than the paper application. Will this be resolved in the next version? And the short answer is yes. However, late 2015, when we launched organ eligibility, there was a paper application that was kind of orange in color that was launched in alignment with the One system. However, that version was pulled shortly after due to various issues with that paper version and was replaced with kind of a modified green version of the application as a temporary solution. We're still using that green version, but will be transitioning to using a new version of the 7210 paper application early 2017. And at that point, the race and ethnicity options will align with those displayed in one. And then there's a question posed around the general timeline for mail out of renewal notices and closed notices. So we've just provided an overview here of what that process looks like. Basically, renewal notices are mailed out, or cases for members who are up for renewal are identified about 75 days prior to the renewal date. And the renewal date is really means the last day of the month in which the renewal is due. From there, renewal notices are mailed out approximately 60 days prior to the renewal date with a reply by date of no less than 30 days later. On the 10th of the renewal month, so the month in which they must respond before their benefits would close if they didn't, on the 10th of that renewal month, the close notice batch is run. And then the close notices are mailed out 10 days prior to the end of the renewal month, and there's a check done right before those notices are mailed out to ensure that if someone has responded during that window between the 10th and right before those notices are mailed out, then that close notice can be prevented. Then the termination batch is run 5 business days prior to the end of the month, and there's also another check that goes on before that termination batch to prevent closes for those who have responded in a timely manner. And then finally, the effective date of the termination is the last day of the renewal month. So if there are more specific questions that you all have around this timeline, please let me know, and I can follow up with more detailed answers, hopefully. And then there was a question around when will the consent form have an applicant's phone number field? And the answer is the latest version does include that field for a client's phone number. So earlier in 2016, there were consent forms that were sufficient to be used with the one applicant portal. However, there was a newer version that came out in late April 2016, which does include a field for that client phone number, and that is also in your handout. So those of you guys who have application assisters or who are application assisters can begin using the latest version of the consent form with that client phone number field if you haven't already. And there was a question around pharmacy outreach. What kind of outreach is conducted to Oregon pharmacies when there's a misunderstanding or issues arise for clients who are trying to fill prescriptions at their local pharmacies? In short, some fax blasts are sent to pharmacies from OHA's internal pharmacy team. However, targeted outreach to pharmacies is limited due to capacity. So there is a link to a recent fax blast regarding hospital presumptive eligibility in pharmacies that was sent out to pharmacies in September 2016, and we have a link to that fax blast. So if you are experiencing issues with your local OHP contracted pharmacies around HPE, you are welcome to share that fax blast with them if they missed that.
So I just want to add a little bit to that. This is Jennifer. That fax blast, it did let them know that we would guarantee payment from OHP on a fee-for-service basis for people who have the hospital presumptive eligibility approval letter. But what I will also add is that they're not required to serve people who are hospital presumptive eligibility or who have the healthcare.gov approval letter. It's just something that we're really encouraging and hoping that they will do. And we have had some positive feedback that that fax blast and that guarantee of payment has helped in our communities with pharmacies taking those letters.
So as far as questions goes, those were the questions we fielded from the Provider Assister Summit. And if you have additional follow-up questions, certainly let me know. Moving right along, we do have another Provider Assister Summit scheduled for December 2nd, and that is in Seaside. And if you haven't seen the information around the details for that summit, you can connect with me directly, and I'd be happy to help you register if you're interested or provide more information about those summits. Essentially, they are a place for our provider assisters to come regionally, and we kind of walk through a number of different topics that are specific to provider assisters We will run through kind of a brief provider web portal training. We have a Jeopardy game that we do to ensure everyone has kind of the same baseline knowledge around tools, resources, etc. for provider assisters. We walk through different internal resources for our assisters. We will have someone from the pharmacy team here at OHA join us in Seaside to talk through pharmacy-specific questions and many other topics as well. So you can connect with me if you're interested, if you haven't already signed up and are interested. We also will hold, we're planning to hold a Provider Assister Summit in the Portland metro area in the spring, as well as in Southern Oregon. So if you aren't able to attend the Seaside event, then you may be more interested, or may fit better for you to attend one of the other spring events. In addition, our Provider Collaborative webinar, our next session will be held on February 15th at 10 a.m. And we will send out more details closer to that date. So, one more topic I wanted to share was, for those of you who have assisters within your organizations or provider assisters, we have started holding they're called weekly assister webinars every Monday at 2 p.m. These are short webinars that are topic specific, and they are this is where we are sharing our timely updates for our assisters. So our team meets internally every Monday, and at different times we learn new information that may be helpful for assisters. So the weekly assister webinars are a place for us to share those updates that are fresh kind of on our minds and relevant to our provider assisters' work. So you're welcome to register for those as an assister, and we have the registration link there up on the screen as well. All right, so that concludes the presentation portion. Do we have questions?